Hi guys, it's Dr. Tauquir Ahmad here. What we are going to do just now is we've got my patient who's had a lot of volume loss and this is due to an illness that she's been now having for a prolonged period of time. And we're going to restore some of the lost volume here by targeting the areas of the deep fat pads. This is not something that we're going to do all at once. We're going to do it in stages. We're going to bring her back in 4 weeks when she's absorbed the filler, it's accumulated its water to see where it is, and then probably pop in some more. And the idea of this is to create a very natural effect of how we're working. So I've done my markings, and what we are going to do is just inject deep down onto the bone and just pop a little bolus in. X-ray. So there is a system known as the MD codes. So what I'm injecting is the area known as CK3. And in CK3 we have certain points where we're injecting. And because she's got a lot of volume loss, I'm focusing on where the medial fat pad would be, just to get that area up to scratch. We have got a sort of a generalized, if you see the skin laxity here, we've got generalized volume loss, so I will try and go on the bone just to put little droplets, just to give a bit more volume replacement and anchoring, but we don't want to put too much in there, otherwise, as she has a naturally high cheekbone, it'll give her an abnormally prominent cheekbone. So it really is a skill of being able to look at the anatomy, look at what's required and the product that you're using. So we're just going to put some micro droplets of filler, just all the way along the bone here. And the purpose of this is just to create some cushioning at the bottom there. You will probably require some more filler, but like I said, we're not doing it on this visit. Okay, probably do it on your next one. Just going to clean the markings away, and what I will do here, Sonia, is just put a little bit of pressure on, just over on here. Let me just get a fresh sword. I'm just going to fold that across here just now. What we are doing just now is this patient has got what's known as platysmal bands. And we're just treating with tiny little drops of toxin here, just to relax these down. So what that does is, the bands that they get, it softens them down and gives them a softer and smoother neck. What I also did was a bit of meso Botox around the neck area as well. Small amounts of Botox into the skin surface, just to give a bit of tightening of the skin. So we've done the crow's feet on one side, we're going to do the crow's feet on the other side, and then what I'll probably do is just a little bit, a wee little trick, a little dot up here for the under eye wrinkles, and then for some of the bunny lines I'll probably be injecting around here as well. We've done the forehead, we've done the glabella, we've done the crow's feet, and now we're just going to do the bunny lines. Okay. And just crunch your nose up. Oh, we've got a lot of bunny lines, haven't we? And just relax. Let's look at your neck bands. So we've injected the forehead, but what I like to do also is, when we're injecting the forehead, sometimes people get a Spock eyebrow or a raised brow, and I really like to, when I'm injecting, leave a little bit that I put in just at the side here, just to make sure they don't get a Spock eyebrow or a Spock lift. And I plan my injections in such a way that I do something called a micro Botox, micro droplet technique, which puts small areas of toxin into the forehead. It also allows me to inject into a point which will stop the Spock eyebrow, and also stops the Botox from going too deep, migrating all the way down and causing the brow to droop down. So done correctly and just with a little bit of planning, you can actually have a very beautiful result with no side effects at all. Thank you. Amazing day, guys. Just an absolutely amazing day today. 3 thread lifts. We did a brow lift, mid face and lower face lift, and a neck lift. So it was quite interesting. Had all the different lifts in there: the brow, the mid face, the lower face, and the jawline. A really interesting case today. Someone who's been unwell for a long period of time. Has had a lot of treatment, and as a consequence has lost a lot of weight, and they lost the fat pads in the face as a result of the weight. So we did a very technical replacement of the fat pads, and the patient's just all features have all come together again. So absolutely amazing day so far, feeling on top of the world. I think I've got 4 very happy patients that I've just left this afternoon, and I think that's a doorbell for the next one. I'll catch up with you later.